everybody. My name is Alex Gain with the marketing team here at Commercial Investigations. We're very excited to bring this weekly program to you to help bring to light some of the things you should know to help protect you and your business during your hiring process. This informational session brings you what is called our What You Don't Know webinar, featuring one of our many experts here at Commercial Investigations. This week we have a verification specialist, Emma Laughlin, and she'll be talking about kind of the recommendations and best practices for hiring nurses and medical staff. So before we get started, just a couple of housekeeping notes. We are going to record, if there's any questions today, we'll record them, but that's kind of just for our use personally. If you have a question during the presentation, please feel free to put it in chat and I will read it for her after. We will record these sessions, like I said, to put on our YouTube and our website if you want to refer to it back there. But for any of that, I will hand it over to Emma now.
Hi, so I'm Emma. I'm a verification specialist here at Commercial Investigations, and I'm talking today about nurse aid registry and other type of medical licenses and things like that that we do verify. So we know how important it is to protect our vulnerable populations. We work with a number of healthcare organizations and medical staffing agencies, so we know how it can be a process to make sure you have the right person for the job. And on that, the fact that these organizations need multiple searches for different people, and it gets confusing quickly. Situations like that are why we started our What You Don't Know webinar, and today we will cover our recommendations for our view on hiring healthcare professionals. We hope to give you something to think about with your background check process and give you information to make the best hiring decisions. The most common position we screen are nurses in general. That includes positions like RNs, nurse practitioners, CNAs, and home health aides. Licenses and certifications need to be searched differently as well, adding another layer to the issue. Also, like all of these webinars, we will be focusing on the New York State licensing and requirements specifically, as that is mainly where we operate. The searches we see the most in this field all have to do with verifications of some kind. Our main 4 verifications include employment, references, educations, and professional license checks. Employment and reference verifications are pretty straightforward. There are some differences between each organization's requirements for those verifications, though. At CI, we usually recommend 10 years of employment history and 1 personal and 2 professional references. Things get interesting when we get into the education and professional license checks, though. Licensed practical nurses, registered nurses, clinical nurse specialists, and nurse practitioners all have different levels of requirements and educations needed to obtain the title. Positions like a nurse practitioner or clinical nurse specialist need a master's degree to qualify and usually have multiple additional licenses to their name. For education verifications, we recommend just getting the highest level earned, but the higher the level usually means more licenses or certifications to be aware of. Luckily, we customize packages to the client, so a nurse practitioner wouldn't get the same check as an LPN. A nurse practitioner's check would be more extensive with multiple license verifications in their field of specialization. Now, earlier we said we screen CNAs and HHAs commonly as well. And you might be thinking, those are certifications, not licenses, so how do you find those? Well, we're glad you asked. Certified nurse aides and home health aides have their own separate databases for finding out if a certification is valid. CNA certifications go through the nurse aid registry. In New York, the search is done by full name and the applicant's date of birth. In other states, it is searched with the Social Security number instead of date of birth. The results will show any past abuse reports on the applicant, certification details, last known employment, and where the applicant trained and completed their exam. HHA certifications go through the home care registry, similar to the nurse's aid, but we only perform those searches for New York. These searches are only done by name, and they find similar details, like abuse records, but the home aid results are not as extensive as the nurse's aid. These searches can be done internally, but you might not get all the information available. It's best to work with a professional screener to save time and get the most information possible. And all of these license and certifications need to be renewed at some point too. A professional license check in the first background check is good, but most employers don't check again. CNAs and HHAs need to be renewed every 2 years, and positions like an RN are 3 years. During that time, a lot can happen surrounding exclusions and license violations. An automated solution to scanning the OIG exclusion list is CI's Vigilant Meds Search. Meds combines the OIG, GSA, and multiple other federal exclusion lists into one search. It is the easiest way to track any exclusion or regulatory acts taken against your applicant or employee. The Office of Inspector General is specifically for healthcare-related actions. And the General Services Administration, also known as SAM, covers all industries of business. With Meds, you can be sure you are getting the full exclusion picture on your applicant. All of our processes are built to streamline the application process, and in a job market as crazy as this, the less friction overall, the better. Using a professional screening partner can drastically improve the number and quality of your applicants, as well as save your team valuable time. Now, this is a lot of information, so if you want to learn more, check out our website for a full description of all of our searches. And back to Alex.
All right. Thank you, Emma. I appreciate that. Very well done. Very well said.
Thank you.